So today we're going to be talking about cupping. My name is Joy.
My name is Alex.
My name is Roberta.
My name is Weiser.
My name is Chase.
My name is Lauren.
Cupping therapy is a form of traditional Chinese medicine. It involves placing a cup on a meridian and poses several health benefits. This presentation aims to discuss several components of cupping therapy, such as the purpose, history, benefits, and adverse effects. It will also discuss 5 determinants of health and their impacts for the use of cupping. Lastly, it will discuss cupping therapy's significance to practice, the integrative health and healing model, which includes the energetic assumptions and resources that are accessible for further information.
I will be discussing what cupping is, along with giving a brief history and discussing the adverse effects and benefits of cupping. Cupping is a method of Chinese medicine therapy that dates back to nearly 2,000 years. It consists of using a cup made of either glass, bamboo, or earthenware. The idea behind cupping therapy is based on the placement of the cups on the body, triggering acupoints, allowing so the skin produces hyperemia or hemostasis, which results in a therapeutic effect. In addition to this, cupping has the ability to drain the body of fluids and toxins, heighten connective tissue, and allow for increased blood flow to the skin and muscles. Cupping can also decrease pain and blood pressure. The different types of cupping consist of wet cupping, flash cupping, retained cupping, medicinal cupping, needling cupping, and moving cupping, as discussed by Ko and Leon. Once the suction has occurred, the cups can be gently moved across the skin. The suction in the cup causes the skin and superficial muscle layer to be lightly drawn into the cup. Cupping is much like the inverse of massage. Rather than applying pressure to the muscles, it uses gentle pressure to pull them upwards. For most patients, this is particularly relaxing and relieving sensation. Once suctioned, the cups are generally left in place for about 10 minutes while the patient relaxes. This is similar to the practice of Tuna, a traditional Chinese medicine massage technique that targets acupuncture joints as well as painful body parts and is well known to provide relief through pressure. Benefits of cupping. It is found effective for many different treatments. The different effects include positive outcomes for blood disorders, pain relief, musculoskeletal disorders, inflammatory conditions, mental and physical relaxation, and insomnia, among other psychological conditions, as stated by Raza, Camp, and Zera. While reviewing the information for adverse effects, it was found that they are very rare. It is likely that the patient will experience some reddening on the site, some bruising, and some pain afterwards and during. The bruising will last depending on how sensitive the patient's skin may be.
So I'm going to be talking about cupping and the significance and implications as an alternative type of therapy. Alternative forms of therapies and medicines are becoming more popular in today's society. The use of cups and suction instead of needles and acupuncture treatment is becoming more popular due to increasing safety towards individuals and decreasing the amount of needle poke/adverse effects caused by needles. Practitioners of traditional Chinese medicine believe that Decreases occur when the vital energy force or life force becomes stagnant or blocked. They refer to the vital energy force or life force as ki and believe that cupping is able to unblock and correct the imbalance in the floor of ki, restoring health. Drawing up the skin is believed to open up the skin's pores, which helps to stimulate the flow of blood, balances and realigns the flow of ki, breaks up obstructions, and creates an avenue for toxins to be drawn out of the body. Cupping's most notable use revolves around pain reduction of the acupuncture areas. Cuppings is said to reduce pain and high blood pressure, as well as modulate neurohormones and the immune system, and also is being shown to improve subcutaneous blood flow and to stimulate the autonomic nervous system. Cupping, both wet and dry, has been used to drain excess fluids and toxins and stimulate the peripheral nervous system as well. In China, cupping is used primarily to treat respiratory conditions such as bronchitis, asthma, and congestion, as well as other conditions such as arthritis, gastrointestinal disorders, and certain types of pain. Some practitioners also use cupping to treat depression and reduce swelling. Fleshy sites on the body, such as the back and stomach, and to a lesser extent the arms and legs, are the preferred sites for treatment. The effectiveness of cupping in reduction of pain, specifically joint and muscle pain, could be a great alternative therapy to pain relief instead of relying on medications such as narcotics. Generally, cupping is combined with acupuncture in one treatment, but it can also be used alone. The suction and negative pressure provided by cupping can loosen muscles, encourage blood flow, and sedate the nervous system, which makes it an excellent treatment for high blood pressure. Cupping is used to relieve back and neck pain, stiff muscles, anxiety, fatigue, migraines, rheumatism, and even cellulite. Given the ability for individuals to obtain information within the touch of a finger, cupping is something that can be easily explored and understood and is readily available for the public to access.
So I will be discussing the determinants of health and the impacts of the use of cupping therapy. We incorporated 5 determinants of health, which are culture, education and literacy, healthcare services, personal health practice and coping skills, and socioeconomic status. First is culture. Cupping therapy is one of the therapeutic modalities of traditional Chinese medicine and is frequently used in Middle East and East Asia as part of their cultural practices. Individuals from these countries are more likely to access cupping therapy for various purposes, which includes pain relief and respiratory disorders, as mentioned earlier. Western culture also acknowledges cupping therapy, but it's not as widespread. Because it is a cultural healing practice, a number of research emphasize that cupping must be tested in other cultures to prevent the possibilities of biases, placebo effects, and cultural influences in determining its efficacy. This notion is supported by Ahmadi and colleagues in their study about the efficacy of wet cupping in the treatment of tension and migraine headache. Next is education and literacy. Education and proper training of the healthcare providers is crucial to understand the principles, the benefits, and adverse effects of cupping therapy. Also, this ensures the appropriate use of technology. Moreover, this will aid the recipients to have a clear understanding on how it impacts and improves their overall health. Next is healthcare services. Cupping therapy is not covered by the provincial healthcare insurance and not normally offered at the healthcare facilities. Therefore, this is not generally accessible to the general public. However, some private and personal insurance care plans cover this service. Next is personal health practices and coping skills. Study shows that cupping therapy produces therapeutic results. According to Morosky and colleagues, cupping improves physical functionings. Other studies also shows that it is effective in alleviating disabling effects of some conditions such as lower back pain and migraine headache. With substantial knowledge about the benefits of cupping therapy, this is a great health promotion strategy which also enhances and improves the quality of life of the individual. And lastly, the social economic status. The cost of cupping therapy ranges from $45 to $60. As mentioned earlier, it is not covered by the provincial health care insurance, which means clients need to pay for the service out of pocket. This determines the ability of the individuals to access this service, especially those who are in a low-income category due to limited socioeconomic resources.
So me and Bobby will now be discussing the model that we have created. In the center of our model, it demonstrates the integrative topic model, which is obviously cupping in the yellow center. Outside of that, in red, is the interrelationship of the key elements, which is present healthcare system, primary healthcare, the relationship with the nurse, and the relationship with the patient. And finally, the outside perimeter demonstrates the determinants of health, which are personal health practices and coping skills, socioeconomic status, culture, education and literacy, and healthcare services. The teal circles are the energetic assumptions, and the 5 that we've chosen are: energy comes from a universal source. Each individual's energy field is unique and provides a blueprint for the perfect state of health. Humans are open, complex energy systems, and when in a state of health, energy flows freely and through and around the person. When there is an imbalance, blockages can be felt, seen, or experienced. And finally, the person is connected to everyone and everything.
In our original concept, we had arrows interlinking every single one of the concepts, but it was very difficult to follow. And so instead, we chose the circle as a medium to show that everything is related and interconnected. I will be talking about the healthcare system, primary healthcare, and a few of the energetic assumptions which correlate to cupping therapy in our healthcare system. According to the World Health Organization, Health Canada, through the Therapeutic Products Program, is actively pursuing national initiative on traditional Chinese medicine. This allows for holistic practices to be available to the masses with appropriate regulation, appropriate technology, and evidence-based research, which aligns with the values and principles of our healthcare system. Alberta includes acupuncture and Chinese medicine, including cupping, among their regulated healthcare professionals. Primary healthcare. The Canadian Nursing Association holds 5 principles of primary healthcare. According to these principles, cupping achieves 4 of the 5 as follows. Accessibility. Accessibility is a problem financially, as cupping is not yet covered by our insurance. But there are many different practitioners all throughout Calgary, so it's readily available for those who can pay. Health promotion. Health promotion is the process of enabling people to increase control over and improve their health. This allows people to choose holistic methods of healing. Appropriate technology. This includes methods of care, service delivery, procedures, and equipment that are socially acceptable and affordable. All practitioners of cupping therapy must have accreditation from the vetted School of Chinese Medicine. And as previously stated, Alberta does consider Chinese medicine as an acceptable and regulated health profession. Intersectoral cooperation is commitment from all sectors that includes government, community, and health. And it is essential for meaningful action on health determinants. As holistic medicine becomes more and more popular, it is our duty as nurses to make connections in the community and alert our patients to the possibility of other helpful modalities, such as cupping.
Next, I will be talking about the relationship that cupping has with the nurse and the patient. Starting with the nurse relationship. Cupping is used for conditions which have been already addressed prior in the presentation by Chase and Alex. With learning about cupping therapy, nurses can become open-minded to Eastern therapies versus Western therapies, which are primarily medications. Learning about this type of therapy allows nurses to become more culturally sensitive and more holistic in their care. However, cupping therapy should only be performed by a licensed massage therapist or doctor of Chinese medicine with a certification in cupping therapy. Next, I'll be talking about the patient relationship. For the patient, they may find comfort in knowing that they have other options. From there, they can decide which method suits their needs. Standardized Western medications include thrombolytics, blood pressure medications, acetaminophen, ibuprofen, barbiturates, antidepressants, and the list goes on depending on what their condition is. However, we have learned from research and from working in the hospitals that there are contraindications with taking these medications and that it may cause harm to our internal organs in the long run. Because of this, cupping becomes more of an ideal therapy, which may be preferred and not so hard on our major internal organs. So next we're going to talk about the energetic assumptions.
Great. The energetic assumptions, as learned from Module 1, Topic 3. The first one is, when in a state of health, energy flows freely through and around the person. When there's an imbalance, blockages can occur that can be felt, seen, or experienced. As cupping is mainly a secondary and tertiary treatment, it focuses mainly on healing once these blockages are found. Cupping stimulates the energy and allows for the movement of both energy and fluids to help remove the blockages and return balance. The second assumption is that humans are open, complex systems. We're all affected by internal and external factors, which coincides with our scientific definition for homeostasis. Through our interactions, we're all affected. Cupping allows for the movement of energy, but also is required for the practitioner and the patient to interact and build trust. The holistic nature of cupping allows for healthy, natural healing with few negative side effects.
Energy comes from a universal source. This indicates that everything has an energetic basis. Cupping aids in ridding the body of negative energy and replacing it with positive energy through the release of toxins. Another assumption we chose was that energy field serves as a blueprint or template. This indicates that each person is individual and unique. Many people will respond to cupping quite differently. While some people may feel energized or rejuvenated by this treatment, some others may really feel lethargic and tired after this treatment. Each person is characterized by a unique pattern of vibration energetically connected and creating an energy field around that person. When there is imbalance, it creates blockages of energy. Cupping stimulates blood flow and promotes flow of the body and the mind. And finally, person is connected to everyone and everything. A person's energy is connected to various aspects, which also ties into the determinants of health. And going back to our model, that is why we have depicted the determinants of health and our energetic assumptions all in one continuum towards the perimeter of our model. Physical, mental, and emotional status contribute to energy balance and blockage, and cupping allows the individual to reconnect with themselves.
So I'm going to be talking about a couple of resources. The first one is a website called World of Acupuncture acupuncture, which discusses how cupping can be used as an alternative to acupuncture. Webpage, and there's another one that is a webpage on the American Cancer Society, which discusses cupping as a complementary therapy for cancer and discusses how some practitioners may use it to rebalance energy in the body that has been blocked by the tumor. Another one is called cuppingtherapy.com, which discusses the different types of cupping available, such as traditional cupping, massage cupping, medi-cupping, theracupping, vacuum therapies, and vacuum mobilization, and the benefits of each method. Lastly, there is one called, there's a document from the Institute for Traditional Medicine by the director Subhuti Dharmananda, who discusses treatment sites used for various disorders. And I found 2 places in Calgary called Great Wall Health Center and Mantra Wellness Center, which are places who offer cupping in Calgary. In conclusion, Shixie and Yu state that cupping contains simple, inexpensive tools and has an easy method of application which provides good clinical effects and virtually no side effects. It's suitable for people for all walks of life for a variety of conditions and can be used both in the hospital and at home to promote healing and well-being. Cupping can be used as a treatment for several conditions such as blood, MSK, respiratory disorders, pain relief, and high blood pressure. Cupping can also be used for physical and mental relaxation and increasing blood flow. An adverse effect of cupping includes bruising, redness, and slight discomfort on the site. Access, costs, education of healthcare providers, and information about cupping therapy are most important regarding the understanding of the impact of certain determinants of health. Lastly, healthcare providers may suggest the use of cupping as an alternative for acupuncture and pain management.